we have to be really careful with extracting healthy teeth in order to straighten the teeth. And the reasoning behind this, that it's done, is understandable. We have a kid who has already gone through most of their craniofacial growth. Their jaws are a certain size, and we know that past a certain point, growth is going to be minimal after that. Most of the growth occurs at age 12 and below, okay? So if we have a dentist or an orthodontist who sees a child at age 12 or 13, we know that a lot of that growth has already occurred. So now we are working with what we have. And so if the teeth are really crowded, there may be only one option, which is to remove the teeth to make more room to straighten the teeth. If they're really crowded, there's not enough room for them, we have to take some things away in order to create room. Now we can do that. We can do that all day long. We can remove teeth and straighten them and make them look nice and straight. But the problem is when we remove teeth, we actually cause a constriction or a tendency toward constriction of the jaw instead of expansion. And anytime we cause a narrowing or a constriction of the bone structure, we are necessarily, as a byproduct, we are decreasing the volume and the diameter of the airway and making it more laborious to breathe correctly. So it comes at a huge cost. Yes, we can get the aesthetics looking better, but at what cost? And retraction sometimes happens also too in order to help to line the teeth up correctly in the relationship of the upper jaw and the lower jaw. The problem with that too is that we're pushing tissues back when we do that. We're urging tissues to grow in a rearward position, in a posterior position, rather than in a forward position, and it tends to make the airway narrower, not wider. So anytime we get ready to do treatment like orthodontics or any dental treatment at all, it could be anything really, we need to ask ourselves first the question, not how is this going to look aesthetically necessarily, or how is this going to affect this one tooth that I'm working on or this group of teeth that I'm working on, but the first question, the first consideration needs to be, how is what I'm about to do as the person's doctor, how is this going to affect this patient's airway first and foremost? That's the first thing we need to consider. After that, we need to consider the aesthetics and the actual tooth itself. In order of importance, that's where that is, airway first.